Good evening, everyone. We want to welcome you this evening to Step Up Live and our Bridges Beyond Benefits discussion around our latest work in our community survey. We're excited about the opportunity to share some of our findings with you and to have you engage with us to talk about the findings. We have joining us for this discussion tonight, Ms. Kimberly Polk, who is our Public Benefits Program Manager here at Step Up, and Ms. Jamekia Collins, who is one of our interns that has been helping with this project in our public benefits and service area. So we're very excited tonight, again, to share with you and for an opportunity to collaborate around our work. Step Up Savannah is available on all of these social media platforms, including YouTube, Instagram, and Twitter. We'll be sharing this on all of our social media platforms and hope that you go there and register to get notifications and sign up to be a part of getting information out for our low to middle wealth community. Step Up Savannah was established in 2008, as most of you know, as a poverty reduction initiative, and we primarily focus on economic mobility and financial security in the southeast region of the state. The agency not only operates as a direct service provider, but we also are elevating our work as an advocate, a convener, a collaborator, and a capacity builder to address the complicated issues surrounding persistent poverty here in the Savannah-Chatham area and in our contiguous counties. Step Up Savannah believes that Savannah is a community where all people have hope and opportunity, and hope just can't be a warm, fuzzy feeling. It's got to be a confident expectation of a favorable outcome. And so we believe that part of our work is to challenge injustice where that is, and to make sure that we're creating pathways for all of our community members to step up to reduce poverty in our community. So when we talk about the word poverty, it's a huge, it's an elephant, and we've got to eat the elephant in chunks. Poverty overall is not just the absence of material wealth, but it's also the scarcity of access, influence, opportunity, education, and justice. And so we want to make sure that as we have these discussions, that we're framing our discussions around not only that larger umbrella of poverty, but how we measure that and look at it in our community. Step Up Savannah has about 6 different direct service programs right now, and we're working to expand each of those programs on every level, and they serve our low wealth community in a variety of ways. They include our AmeriCorps Vista program, where we actually support our social safety net with skilled labor and volunteer hours. It includes our Chatham Apprentice program, where we focus primarily on workforce development and employability skills. We have our financial literacy and financial security program called Level Up, where we actually work with individuals to not only learn basic financial skills, but to expand social capital and build assets. We have our neighborhood leadership program, where we are teaching emerging leaders how to advocate for themselves from self to system. Our public benefits program, where we're enrolling and screening people for public benefits and making resource referrals and looking at opportunities to expand their bridging capital across the social safety net. We also have a working family network, where we support the social safety net as a group of collaborators working to fill gaps in our current social safety net in our community. So one of the ways that Step Up has refocused and reframed our work around poverty is to directly take a look at asset poverty. And so as such, one of the things that we want to do is really hone in and help people understand what economic mobility is. Economic mobility is essentially the ability of a person to change their income over their lifespan. And so when we're looking at economic mobility, we're measuring some of those primary indicators in our community and those hindrances to economic mobility for the low wealth community. And if you were measuring poverty, you'd probably look to see if someone's income was increasing over time and if they've been tuned in enough to take advantage of economic opportunities and receive asset building movement and the accumulation of those assets over time to prepare for financial emergencies such as the pandemic, for example, or any other life happenings. But to accurately measure someone's trajectory out of poverty, you not only need to measure economic mobility, but you also need to measure other dimensions of poverty that include power and agency and social connectedness, meaning how can they access what's available in the community to even move forward and change their trajectory of their economic mobility. And some of the primary predictors of this are around education, location, and background. So when we talk about asset poverty means that someone has insufficient net worth to cover their living expenses without income for about 90 days. And it also means that they lack durable assets like savings accounts, home ownership, or 401ks, or health insurance, portable health insurance, and things like that that we traditionally take for granted in the middle class. But more often than not, when people talk about poverty, they're usually using census data and using the federal government's basic line for income poverty. And that always doesn't tell us the true nature of whether or not someone is actually living as a working family in asset poverty. And so it's important for us to understand both as we work to overcome poverty in our community. One of the ways that we look at that when asked for asset poverty in our community, we know that it is still a huge issue. Prosperity Now did a look at asset poverty in Savannah in 2020. And what you'll see here is that households with zero net worth by race, so asset poverty, is disproportionately impacting communities of color in the Savannah area. And when you compare that also with the income poverty rate, you see that that gap is still present. So let's talk about that for a minute, because again, remember, economic mobility is about a person's ability to change their income or grow their income over time. And when we do deeper dives around Savannah's economic mobility ranking and around the trajectory of children who are now living in these various census tracts, these were just census tracts that we pulled that were more familiar to most people. But a child growing up in our community on the east side, for example, by the age of 35 is only slated to make or forecasted to make $19,000 a year by the time they're 35. So as you can see, the economic mobility and asset poverty in our community is still a very real issue and something that we need to not only be talking about, but looking at ways to change this trajectory. If they're growing up in Caton Fraser, that drops to $16,000 a year by the time they're 35. So now we have an adult still living in persistent poverty. And so we wanted at Step Up to begin taking a look at not only what we perceive to be the barriers, but what actually are the barriers, and taking a expansive approach to not only defining those clearly, but working to solve for them. Again, this slide is just showing what poverty looks like in Savannah, and 60% of those folks on the previous slide, again, are 60% or greater are people of color. And so it's important that we recognize that economic mobility is also influenced by the wealth equity gap in our country. For every dollar a white person owns, a Black person owns 10 cents, a dime. And so that is something that, you know, it's a tough conversation, but it's one that's needed to be had. The other thing that we are beginning to measure here at Step Up Savannah is what is known as the benefits cliff. And essentially a cliff effect is when a person who is on public benefits, they're working, and public benefits is being used to supplement their income. As they increase in income, they are likely to lose the money that was helping them cover that gap, or have a significant reduction in those benefits, even though their income is not sufficient to sustain their household. And we have lots of families, working families, who we talk to almost every day here in our public benefits program and in our CAP program, who are living in the benefits cliff. And these are people who are working and have to choose daily between whether or not they're going to pay their light bill or eat for the week, or whether or not they're going to purchase medicine or gas. And so those are very real issues in our community. And so the thing that we've noted about our social safety net over the last year or so is that we don't have enough bridging capital over our social safety net to keep people from falling or to support them on their way to self-sufficiency. And so that is another area that Step Up Savannah is taking a bolder and a fresher look at in our community. We wanted to take the time to get a baseline community survey of our LMI community, and just to give us some data to help support our assumptions or to dismiss our assumptions and help point us in the right direction. So between April 1st to May 1st, we worked with our key partners, social safety net partners, to target the LMI community and to get a month's worth of survey data just about some of the economic mobility hindrances or the gaps in our social safety net or blocks for this group. And these are the key partners where surveys were collected, both electronically and paper surveys. And we, again, received 534 unduplicated responses. And so we're going to share that work, just a preliminary overview of what that survey told us tonight. And so I'm going to turn it over now to Kimberly Polk, our public benefits manager that helped lead this project along with our social services intern.
Awesome. Thanks, Alicia. First, we're going to talk about the demographics, and I'm going to turn it over to Janikia, and she's going to go over that information with us.
Hello, everyone. I'm Jamie Collins. As it's been stated, I am an intern here with Up Savannah. For this semester, I'm a second-year graduate student at Georgia Southern University, and I'm going to talk about the demographics of this survey that was taken. So throughout the 534 responses, we received a wide range of demographic data. As you can see, nearly 60% of our survey participants self-identified as African American. This was followed by Caucasian at 30.3% and Hispanic at 15.5%. As you can also see that most of our participants self-identified as female, but we also had about a 30% male participant rate. For our county different demographics, the primary county outreach was completed in Chatham County, but other counties are also accounted for. About 86% of the respondents came from Chatham County and surrounding counties. The rest were unknown zip codes, so the numbers here could possibly be higher. So for education and age, we can see that about 90% of the survey participants completed a high school diploma or achieved greater higher education. 11.4% completed some high school. And of the participants, 45% of the respondents were between the ages of 18 and 45, and 55% were 46 or older. The average age of the participants was around 35 to 44 years old, which is in the middle category. And our research team determined that there was no data that was skewed to a younger age or an older age. And this is a good sign because it represents the larger population and adds a level of credibility to our survey. So this slide discusses home and children life. So we can see that of our survey participants, they were mainly single parent households at 43.8%. This was followed by two parent households at 35.4%, and about 17% of the households were raising children that were not of their own, which was an interesting find, and a small portion, 3.9%, shared custody with other households. So for our employment status, you can see in the chart provided that a little less than half of our participants were working full-time, followed by 13.7% of our population that were working part-time. As you can see, there's about 40% of participants who said they were not working. From this, we can gather that roughly 60% of our participants did not have a stable job that paid payable living wages. So we concluded from this that about 62% of our households included 1 to 2 people that were working. The other 12% were households with more than 2 working members. Further, we also asked who was unemployed, and 85 respondents responded with yes, and 247 responded with no. And we could think of this in terms of unemployment rate. The unemployment rate is calculated by those who are both unemployed, but are also looking for work. So we see that of the valid responses, about 25.6% of the population is looking for work. So this slide looks at gross household income, and we can see about 70% of the folks who took our surveys income was under $45,000. The other 30% accounts for over $45,000 or more, and the rather not say group, which are those participants who did not disclose their income level. And this data confirms that we did indeed target the low to middle income community. This slide talks about the housing status of the participants, and here you can see owning and renting scored about the same percentage and dominated most of the answers. Obviously, this is aligned with reality because most people own or rent their home, so this is not a surprise. Since we do know it is harder for people to own homes, it was a pleasant conclusion that nearly 40% of our participants did own their home, but there is always certainly room for improvement in this area. And further, based on the local census data, approximately 47.4% of Chatham County residents are homeowners, and 49% are renters, spending 30% or more of their income on their rent. So our survey data is about 10% lower than the county average, but still comparable data. 59% are renters or other living arrangements that did not include them owning a home. So now I'll be turning over to Kimberly Pope for our key takeaways for our survey.
Thank you, Demikia. So I'm here to talk to you about the key findings from our survey. So first, our research team did some means tests, and we found that the average income for those who are not single parents were about $10,000 higher than those who were single parents. And this does make sense because we know that often single parents cannot work as much or find it difficult to obtain more education to advance their career than dual parent households. The survey conclusions for criminal background impact on income were quite astounding. The average income for someone without a criminal background is about $20,000 more than someone without a criminal background. So this information shows that we need to advocate for folks with criminal backgrounds to make livable wages. We know that obtaining livable wages and being able to afford basic necessities decrease the need for criminal activity. We also screened for housing related issues. Nearly half of the participants said that paying the cost of monthly rent and utilities was their #1 issue. This was followed by finding safe and quality housing and making a down payment on their home. And then about 1/4 of the participants said that finding housing near public transportation was an issue. Here we looked at work-related issues. And so we see that nearly 50% said that they needed livable wages. And this was also followed by the job with benefits, which also adds to their net worth. So that makes sense that those two would go together. And we know that in Chatham County, the livable wage for one adult and one child is $29.34 an hour. 2 adults and 1 child with both adults working is $16.07 an hour. The more children, the more the livable wage need increases. So livable wages are difficult to find when the minimum wage in Georgia, or in the federal minimum wage, is $7.25. So, and then the after livable wages and jobs with benefits, finding work was the next in line. And so this shows that we certainly need workforce development programs in our community. So of course, we looked at how COVID has affected the LMI community. And we saw that 25 or almost 26% of our participants were unemployed due to COVID and looking for work. And nearly 80% of our participants said that COVID affected their ability to work. So that the reason for that may be, the children were at home, so they couldn't go to work, or they had limited hours because they were taking care of their children, or they had to shut down. So a lot of folks in the LMI community is working, at the hospitality restaurants or restaurants and hotels and stuff like that. And so those are the businesses that shut down in the pandemic. So this shows the COVID-19 impact on income. On average, someone who experienced reduced hours due to COVID has an average income about $10,000 less than someone who did not lose hours. The shutdown, of course, affected the frontline workers, like we were saying, the hospitality business. So here we looked at how folks access non-governmental agencies. And so we can see here that the majority of folks or 32% access food banks and soup kitchens, and then 40% was accessing low-cost healthcare. And from this, we found that there was a lot of, it looked like there was quite a bit of food insecure folks. And then, 16% was a faith-based organizations, but most of the time when folks are contacting faith-based organizations, we know they're either looking for food or cash assistance. So we could actually probably add some of that to the food assistance category. So here we looked at folks that were denied non-governmental assistance. 30.8 were denied non-governmental assistance. Out of these participants, 66% said they did not meet the requirements, and 34% said the agency did not give enough resources. This shows us that, quote unquote, not meeting the requirements is an issue in our community. Nearly 70% of those who needed assistance were denied due to not meeting requirements, which means it's important for us as a social safety net to look at requirements and how they are able to assist those who are in need of these resources. So we looked at non-governmental assistance, and then we looked at governmental assistance. Here we observed the participants who are receiving governmental assistance. 26% said that they were not receiving benefits, and then 26% said they were receiving governmental health insurance. Smaller percentages received SNAP and TANF or Social Security and housing. A minuscule amount of participants received childcare and WIC. And this is important when we are looking at the benefits cliffs, because receiving governmental assistance does not mean that you have wealth and are self-sufficient. Often those in low to middle income populations not receiving benefits are just as bad, if not worse off, than those receiving benefits. These are where the benefits cliffs arise, and we will discuss this on the next slide. So here we see the difference in income from one receiving SNAP and one not receiving SNAP. That, we would think that, someone receiving SNAP was making less than someone not receiving SNAP. And here it's showing that it's about a $10,000 difference here. But what this doesn't show is the benefits cliffs. So if we look at a household, for example, a household of 3, they're making $15,000 salary. The approximate amount of SNAP benefits that they would receive would be about $490 a month. So we multiply that by 12 months, and this would add to $5,880 to one's income. This would now put the household's net worth at $20,880. So we're getting closer to that 35,000 or about 30,000 line there. But this would not, this is not including other possible benefits, such as childcare benefits, housing, vouchers, school enrollment benefits, and health insurance. The folks not receiving SNAP are likely to not receive the other benefits. So this now makes those receiving SNAP comparable in net worth to those not. Sometimes those on governmental assistance are higher than those who don't have them, have higher net worth than those who don't have the benefits. And then if we're only making $30,000 a year, we're still, folks are still choosing between basic necessities. So do I purchase food for my household, or do I pay my light bill? So there's not really much of a difference here when we're looking at net worth and asset wealth and asset poverty. So this one, we looked at the needs that are related to public benefits assistance. Both folks who receive and do not receive benefit answered this question. Nearly 1/3 of those surveyed needed help affording basic needs. Another third needed utility assistance. Another need that was brought up was a need for helping applying for services and a need for housing assistance. The other needs were food access and costs, mental health, time, and then contacting support. So we asked the question, what kind of healthcare, if any, do they have? 75% of participants said that they had access to healthcare. And this included either governmental or non-governmental assistance. And it included dental, health, and eye. The other 25% said they did not have access to healthcare at all. Of these people, most said the reason was that insurance is not affordable. A small percentage said they don't know how to get access. This shows that there is still healthcare need in our community. So we also asked a question about technology access. We asked, do you have access to a smartphone, laptop, tablet, Wi-Fi, landline, or do you not have any access? Most of the people surveyed had access to a smartphone, while only half of the people surveyed had access to Wi-Fi. An important note is that 6% of the people surveyed did not have adequate access to technology, a concern that also came up in the Working Families Network survey that we will discuss later in this presentation. The data from our survey lines up to be about the same as those making less than $30,000 in 2021. National average data, which adds credibility to our survey. And then not shown here is that the national average for no access was about 13%. And so this is compared to 1% from households making more than $100,000 a year. And we know that the majority of our, as we can see here, the majority of our population does access the smartphone, but how are they able to use that smartphone? I mean, of course they'll have data, but sometimes that data is limited. But if they don't have Wi-Fi access, because the Wi-Fi access is about 30% lower than the smartphone access. So that's an important point to keep in mind. We also looked at how folks get around. What's their primary means of transportation? About 67% said they owned a car. The other 33% said they used other forms of transportation, which can be less reliable. And then around 5% walked or biked as a primary means of transportation. And we know that weather can play a vital role in getting from point A to point B with those. Here we looked at the transportation issues. An average of 21% of participants said that they had transportation issues, while an average of 43% said they did not. The other 36% selected that the issue was not applicable to them. Here's a breakdown of those that said they had transportation issues and the percentage of each. Most of those who had issues with transportation either said they needed reliable transportation or cannot afford transportation. An important note here is that though we saw quite a few participants owned a car, so like 60% of them, we also see a large amount, the whole 30%, so half of those folks said that they needed reliable transportation. So that's, they may have a car that may not be reliable. So that's important thought to keep in mind. So now I'll turn it back over to Alicia, and she's going to talk to us about the Working Families Network survey.
Kim, can you go back to the last slide? There was a key point that I think all shows should put out there. We know in our community, we have a reentry problem. We have one of the largest populations returning to a county in the state are returning here to Chatham County. And as a part of the reentry service model, a lot of those folks can't access their license or ID. And so I thought it was crucial to point out that at least 17% of the folks who we know also had criminal backgrounds who took our survey needed a license as well. I also think that it's important to note that 15.2% of our those who responded noted that a bus route does not come to my area. When we know here in Savannah, countywide transportation is a huge issue. We just don't have countywide transportation. And those census tracts that we reviewed, and there's probably a total of 15 or more census tracts with the highest numbers of those folks who live in asset poverty, there's no bus route that takes them from Savannah into our manufacturing and logistics areas where some of the better jobs, employment opportunities, and higher livable, sustainable wages are. So we're almost wedging those people in. If they have no transportation, we're forcing them to basically stay in jobs that are not paying them livable wages, such as hospitality services or frontline workers in restaurants and so on, who are not making the money they need to support their family. But they could easily hop on a bus if we had one and get out safely to the logistics area and some of our manufacturing and ports areas where there are high paying jobs. So one of the a low hanging fruit issue for our community would be transportation justice and equity, ensuring that those people who live in those highest impoverished and asset poverty communities actually have a way to get out of it or increase their economic mobility simply by providing a bus route to better paying jobs. And so I just wanted to point that out as we transition.
And Alicia, we actually had a question in the chat that might be something going into your next section that you can probably address. Zoe asks, CETA says that there are more than 250 workforce development programs in the metropolitan area. How can we bridge the gap to let the LMI households know about these? So kind of going into your next section, that might be something that you can kind of answer going through this next survey.
Yeah, certainly. So when we get to, we're going to talk through one of the things that we took the time to do while we were surveying our community. We also took the time to survey just to get a little bit of baseline information from some of our social safety net providers so that we can have more of a well-rounded view of what's actually occurring in our community. And so we're just going to share a few of the outcomes from that information. So we had about 42 agencies participate. And so that means that we got a pretty good snapshot of our social safety net. And there was quite a mix from advocacy all the way down to food services, health services, and so on. Of the services offers, you see that job training was one of the highest. So that falls in line with what CETA is indicating about what's available in our community. Food services and youth services ranked up there as well. Again, I want to point out that transportation and mental health are also gaps in our community that we know that we need to increase services around. So the survey bared that out. Kim mentioned earlier on, one of the key findings in a survey was that 66% of the LMI community could not access needed services. And so those folks fell in that benefits cliff and were unable to get the assistance they needed, because when we take a look at our social safety net, many of our social safety net providers actually have or have adopted the same requirements that are enforced by our federal government. And so income eligibility is a real issue. And so one of the things that we might want to take a look at here is to do a full overview of what requirements there are and which ones are truly really needed, and how we may be able to flip those requirements and create some bridging capital for those who are experiencing that benefits cliff. Also, if I don't have a license or I can't get an ID and 9% of the agencies require me to provide proof of identity, that means I'm totally locked out if that's the only way for me to access services. One of the things that we discovered is that our social safety net providers don't think people are adequately aware of the services that they provide. At least 52.3% of them said some are, but what we found is that there's not a lot of information. One of the things about poverty, remember in that definition at the very beginning of our presentation, is that it's also the scarcity of information. Because likely I have a very small circle or very minuscule social capital, and I'm constantly living in the tyranny of the moment. Again, choosing between balancing all of the balls in the air, keeping the plates of my household spinning, my basic needs plates. And so I don't have a lot of bandwidth to get new information. And likely the people that I'm talking to in my social circle likely don't have that information either, because they live in that same tyranny of the moment. And so just the lack of information alone can keep someone hostage in or create a barrier for them to increase their economic mobility. One of the other things that I want to point out here, even though we may have a large number of job training programs in various and sundry iterations in our community, one of the things that we see as we look across those is, do they all include wraparound servicing? Do they all include need-based stipends or assistance? For example, after I've completed a training program, am I being, is there a bridge built for me to reach an employer? How am I going to overcome the transportation barrier or the childcare barrier, which is another huge issue in our community? While childcare centers are opened, we have a very limited number of quality rated daycares and childcare spaces. Those spaces are even more limited because of COVID restrictions. And now the premium cost of those daycare spaces really lock out some of the people who could be working right now. They can't afford to work, and they likely may not be able to get one of those premium spots in childcare. So that's a consideration. Some of the social safety net challenges and concerns that were reported to us about those from our social safety net providers were that there was a lack of funding and so on. but a lot of them talked to us about what programs they felt were still needed in the community. 15% mentioned public transportation, 15% mentioned community outreach, and 27% mentioned affordable housing, and which we know is an issue because of those folks that we saw were renting, living with someone, that was about 60%. And so we know those people are cost burden renters who are spending anywhere from 30 to 60% of their income on keeping stable housing if they can. Even if I'm living with a friend, I'm likely paying some part of the rent or utilities in that situation. We also know mental health and wellness is a concern. And so our survey bared much of and confirmed some of our assumptions about our social safety net. The top challenges that agencies are facing right now, of course, is funding, access for clients, the need for more staff. COVID-19 is impacting us all at every level. There's space and capacity issues, lack of awareness, volunteers, and the need for more resources and opportunities. And so these are on trend with what's happening across the social safety net nationwide. But again, it was a good opportunity for us to affirm what we thought was true. So what now? And there, Kim can join me here, but there's a lot of opportunity here. Lots of ways that we can look at collaborating, evaluating, and enhancing programming across our community.
Awesome. So yes, we wanted to mention that we should evaluate our program requirements. So ask your agency the questions: are there necessary requirements that can be changed to be all inclusive of the entire low to middle income community? Are there services that can help raise the net worth and alleviate pressures they are facing? We also want to continue translating the data. This is preliminary research. We're going to continue to do our part to continue looking at the data, not only from the Bridges Beyond Benefits and WFN survey, but also trends that we're seeing from other data sources, and comparing what we have found in our data to that. We also have a new tool. It's called CODE, Career Opportunity Dashboard for Economic Mobility. And this was created by the Federal Reserve Bank in partnership with Up Savannah. And so this tool, there's two tools. There's one that's a dashboard and one that is a planner. And so the dashboard helps to communicate the public benefits cliff at a high level. It shows how many tax dollars would be saved if someone were, or if our community would support that person. The planner could be used more of a career guidance tool, and it compares different careers compared to the self-sufficiency standard. So Up Savannah is helping folks with this. If you have someone that you would like, that you think would benefit for such a tool, we can certainly help them. Just contact the Up Savannah office. And I'll also drop some links in the chat for the planner and the dashboard. We also want to create programming aimed at mitigating the benefits cliff. So how can we look at our programs and connect between the social safety net and the LMI community? And that kind of goes hand in hand with expand connection to the LMI community. So how can we, help bridge that bridging be a part in that bridging capital and help folks mitigate the cliff. We also want to enhance effective programming. So how can we better our programming to help those in the LMI community? And then lastly, we want to look for funding opportunities that will build upon the services. Are there opportunities within funding to build meaningful partnerships and then also combine the assets of our local social safety net? Alicia, do you have anything else to add to that?
No, we can now take questions. We appreciate those who've joined us. Do we have any questions online or in the chat?
We did have one in the Facebook comments as well. Harley said she's interested in the connection between the number of agencies working on workforce development and the numbers we saw in lack of employment / paying jobs, and just asked if we had any thoughts on that.
Yeah, so job training doesn't always connect to employment, right? One of the things that we know are barriers to employment are transportation and childcare, and we're seeing that bared out, right, in our survey, as well as employability. And so when we have people who are coming back to our community who may have been justice impacted or justice involved in higher numbers, they're not even able to get a license. And some of our programs require IDs and so on, which can even be a barrier for them accessing workforce development programming. So the number of training supports workforce development and the economy by supporting employers primarily. And ensuring that we have a work-ready workforce in our community. But when we talk about the LMI community and their access, we know that access doesn't always equal opportunity because there's less bridging capital to help those folks access that opportunity and then use that opportunity to move forward because of other barriers to economic mobility, which can include criminal background, education, transportation, childcare, and some of the other issues that we talked about tonight. Any more questions from our participants? Thank you, Yvette. We appreciate you joining us tonight. We hope that you take the opportunity to share this, to have broader discussions with your agencies, or to reach out to Step Up Savannah and join the conversation around this information. And we'll be looking for ways to create some more discussion and roundtables. So thank you so much for joining us tonight. We want to thank Kimberly for her work on this effort and supporting this work along with Jamikia. We certainly appreciate them, along with Jacob Crawford, who was one of the initial interns that began analyzing our survey data. I saw that an anonymous person asked for our slide presentation. Our video will be available on our Facebook page, and so you will have full access to our live streamed video there. Any more questions, thoughts, or concerns that we can assist you with this evening? Anything else, Mary, in the chat?
I haven't seen anything else come through yet, no.
Okay, again, thank you. Thank you for joining us tonight, and we look forward to continuing this important work and collaboration with our community. Good night.